Hi there, everybody. It's now 1 o'clock, so we're going to go ahead and get started. I know we've got about 20 participants or so on the line already, and I'm sure we've got we're expecting more than 50 participants today. So we want to be mindful of everyone's time, and we'll start now. And as others join in, they can listen as they get in. So welcome, everybody. I am Helen Hockey, and I'm the Executive Director for the Pennsylvania Coalition for Oral Health. I'm joined today by Jenny Engelert, our Board Chair.
Good afternoon. It's great to be able to connect with everybody in this way. Makes it much easier, particularly this time of year.
Yes, and that's, I appreciate everyone taking the time today to join us. It's a beautiful day, and hopefully you guys are going to have a good weekend, but we'll take a few minutes of your time. I will say that I know not everyone is able to join by video. So for those of you who are calling in on the phone, we will be trying to, we're showing slides, but we'll try to explain what's on the slides so that, you're still able to get a lot of information from what we're sharing. And then we will share the slides after the call as well. So you should be able to see the slides will progress here. So we have a fairly full agenda. I will say, we're going to give you guys an update on our priorities as a coalition. We're going to talk a little bit about the state oral health plan, which will be in effect from 2017 to 2020. Most of you are probably familiar with our Pennsylvania Oral Health Collective Impact Initiative, which we fondly refer to by its acronym POCI. And then some upcoming dates and important events in our state through the summer here. At the end, we will do a brief question and answer session. We're going to try to leave about 15 minutes or so for questions and answers. We have disabled the raise hand feature, so if you have questions, you can just click on the Q&A button and type them right into the question and answer panel. And we'll either grab them as they're coming in and answer them, or save them for the end and answer them then. So we also have a polling function, which I will do our first little poll here to see how this works for everybody. You should all be able to see the poll that just popped up on the screen. And we just wanted to know how many of you have joined us before, either by video or live in person at a coalition meeting. So we'll give that about 30 seconds to pop through, and then we'll be able to show everybody the results of that. And it looks pretty good. I think we're getting there. And okay, so what I'm going to do, since that was more of just a sample there, I'm going to go ahead and end the polling, and we will be able to share those results. I believe everybody can see those. And it looks like we've got about 3/4 of our attendees today that have been at a function before, and about 1/4 that are first-time attendees, which is great. So welcome to everyone. And back down there. Okay. And then, so progressing on here, I have a slide with our funding partners. It really is only through, grants and funding partners and our members that, we're able to continue all of the work that we do. So I want to say a really big thank you to, the supporters that are featured here, and then we also have our members and our smaller community supporters listed on our website. So we keep that list updated at all times, and I welcome you guys to check that out. It's on the support page of our website, and we do all of our work as a true community and state coalition, and it's often said, but I truly mean it when I say we could not accomplish anything that we do without the support of everyone. So I think that that's one of the best things of our coalition, is that we do so much work collaboratively. So speaking of our work, moving into our 2017 PCOH priorities, We do have our main priorities that we focus on each year. So for 2017, our main concentrations would be, of course, supporting Pennsylvania oral workforce development, improving oral health coverage for Pennsylvania's most vulnerable populations, advancing implementation of the 2020 Oral Health Plan, and then last but not least, advocating for community water fluoridation. So those are our 4 priorities that we have identified, and we're going to go through each of these and give you all just a little bit of an update on the progress that we've made up to this point. So first, talking about our oral workforce development, many of you joined us at our summit in November of 2016, and one of the big accomplishments that came out of that summit was identifying, it was actually 17 prototypes at the time, different varieties of kind of workforce initiatives that we could move forward with in Pennsylvania. We have anywhere from 8 to 10 prototypes now moving forward at least some kind of progress level. And then I would say we have 5 or 6 that have made some really extensive progress. One of the plans that I have for the coalition and for our website would be to get all of these prototypes listed on the website along with the progress made. And my goal is to have that done in the next month. So please stay tuned. If there's something that you want to know more about, you'll be able to find some information there. And of course, you can always reach out to us at the coalition. I do want to stress that all of this is true coalition work. It's not necessarily staff or board work. What we do is, utilize all of our community members and stakeholders to get the work done. So I thank you all for that. Every individual, whether you're on the call now as a first-time person, can get involved. And then also, maybe you were involved in a prototype at the summit and you've lost touch with your group and you want to get back involved with something, please feel free to reach out to us. So, and yes, I'm seeing Bernie's question. We're going to talk about our mission of mercy towards the end here. So, but I'll put the plug in there now that we're going to talk about mission of mercy. So for everyone who may not be aware of that, it's a great project and you're going to learn a little bit more about it towards the end of the call. So one of our prototypes that is doing well and moving forward at a great clip is our Tele Dentistry prototype. So, we've got a couple different terms. We say telemedicine, we say telehealth, we say Tele Dentistry. I actually like telehealth because I feel like it encompasses everything. But Tele Dentistry is something that a lot of states have picked up on, and it's a really important thing for our state, mostly because we have so many rural areas. So we're fortunate to have Dr. Brittany Knoll in the Pittsburgh area who has been kind of spearheading this initiative. She's been working with the local intermediate unit in Pittsburgh and kind of doing some pilot programming and demonstrations to see if utilizing public health dental hygienists out in the field who can then remotely report back to her at a main brick and mortar building. It's working, and what we're seeing is that the exam is essentially able to be done live, and she can report out and get more information on anything that she needs as the patients are being examined. So we're moving ahead, investigating some of the support from managed care organizations and the Department of Human Services. We know that it's a good solution for rural areas. The only kind of barrier that we have seen thus far is the internet connections sometimes in rural areas are not optimal. And so that's something that we're looking into, as a barrier that we need to overcome. The next workforce prototype I just wanted to highlight, and we just selected 2 for this meeting, is our OHEX group led by Dr. Eve Kimball. OHEX actually stands for Oral Health Education in Captive Settings. And so she started this back in Reading, and now the project is actually expanding to multiple sites around the state. So the gist of it is that we would use public health dental hygiene practitioners and also other professionals to serve as dental educators and navigators within the medical office. What I do want to stress with this is that it's not designed as a clinical practice. It is definitely more navigation and education based. What it does is it provides the patients with a warm handoff so that, you know, when you've got parents and kids in a waiting room and they've got nothing else to do while they're waiting for their clinician to come in and see them, then they're able to get some oral health education and also get connected with a brick and mortar dental office that they can get to. One of the side effects, I think, of Eve's project was that they found out that the doctors and the staff are also getting better educated on oral disease. So they were able to recognize more decay, and they became stronger advocates themselves. And what that led to over a 6-month period that Eve found was a 7% increase in completed dental referrals. And, you know, we all know it's one thing to make a referral in an office, but it's something else entirely to have the patient see it through and actually get to the dental office. So that 7% is a pretty amazing number. And so we're hoping that that can continue on. They've gotten some, you know, funding, and we're looking at different ways to keep moving that project and increasing it throughout the state. So. And our moving on to our next priority, talking about improving oral health coverage for Pennsylvania's most vulnerable populations. I'm going to turn this over to Jenny to speak a little bit on this. Jenny?
Thanks. We're really excited to be partnered with Put People First, as well as Achieva, to have an advocacy day in Harrisburg on June 13th, and it'll be our first effort of this kind. Front and center will be the PCOH policy brief, and so that will be distributed, kind of papering the Capitol with that brief. But we really want to thank Morgan Plant, who is scheduled, Helen, I think at least 6 meetings with key folks. Yeah. And so that's pretty amazing, particularly for a session day. Maybe some of those will work and some of them won't, but to go into the day with that many meetings scheduled is really a great thing, and Morgan did a lot of work for us. Put People First is bringing and engaging several folks who are most impacted, Medicaid recipients, who are going to be able to share their stories and speak to the challenges that they have and their fears and concerns as we move ahead. So we're staying focused on that, maintaining and retaining the current coverage for adults and for pediatrics under the Medicaid benefit right now. And I think specifically to talk about where we are with Medicaid, I think there's another slide, Helen. Great. Just wanted to spend a few minutes. I know that many of you on the call have your own outlets for information about and changes to our healthcare plans at a federal level. And now instead of ACA, we're talking about AHCA. But we just wanted to highlight a few things in general, and then some things specific to oral health, just to make sure that are on your radar screen. Like I said, again, at a state level, we're focused on advocating and educating around the maintenance of and retention of our adult benefit and our pediatric benefit. And then as we back up to the federal level, we're really focused on helping folks understand how important the Medicaid benefit is to all of the folks that we serve, and really overall health across the state of Pennsylvania. There's some specific challenges with what's being proposed right now, and this list could be much longer. We could have many more slides, but we've selected a few to focus on in our message with you all today. And one is just the framing, right? So this is the shift from largely federal control to largely state control of potentially carrying greater costs and design of benefits, because there will be less overall federal dollars. And just to put it into perspective, those less federal dollars proposed in the president's budget anyway are looking at about 1.3 trillion reduction over the next 10 years. And that is 610 billion on top of the AHCA proposed cuts. So those are big numbers. It's hard for me to get my arms around all of those zeros, but what I can easily envision is the direct impact to the patients we serve at our health center, and that broader impact across the state. regardless of exactly what shakes out, because as we all understand, the AHCA is been pushed to the Senate, getting a major overhaul. Apparently, it will then need to come back for reconciliation to the House. So, you know, this is not a quick overnight process. But if we look at the president's budget as it's been presented, and the work that's being pushed around AHCA, we are looking towards a growing number of uninsured. That's what we're expecting, that's what we're framing, and that's talking about more broadly. So that's both Medicaid and changes to the marketplace and those folks who were insured there. So while we don't know exactly what that might look like, our advocacy is hugely important because there's nothing that indicates to us, either in budget or AHCA regulatory process, that doesn't indicate that there would be less insured. Then thinking about Medicaid specifically, payment methodology is proposed to change, whatever the plan looks like. And at this point, we won't focus on per capita versus block grant. Those are the two concepts that are being pushed around. But most important is to understand less dollars coming to states, less federal dollars, less dollars coming to states. And regardless of the methodology, that is likely to result in less benefits, less coverage, and or less people covered. So one of the advocacy points we received most recently was really advocating for people to focus less on the choice between per capita and block grant, and more on the fact that Medicaid is important and Medicaid needs to be maintained. When we get into the fine tuning of it, we can start to talk about the payment methodologies, but at this point, a very clear message to anyone who will listen about the importance of Medicaid is hugely important. As I alluded to just a minute ago, whatever proposals we're looking at, President's budget or AHCA proposal, we're looking at reduction in required services. And that's largely being instituted through the regulatory process driven by Tom Price, our Secretary of Health. So that a lot can happen through that process, and we've already started to see those reductions in required services. All of this presents a great risk to oral health. As we all know, we've been on this kind of uphill battle to position oral health to be understood as integral to overall health. But we've still got work to do on that front. So at times when we're talking about less dollars, less required services, changes in our thinking around Medicaid, oral health is at great risk. And I wanted to highlight just a couple of specific things to oral health that came to us from Families USA. And as we look at the president's budget, there is a proposed cut of $1.5 million, which is almost 50% of the budget going to the National Institute of Dental and Craniofacial Research. Knew I was going to get tripped up on that one. It eliminates funding for HRSA general and pediatric dental residencies and cuts other workforce development programs that are in relation to oral health. And in addition, a 20% cut to the NIH budget. So those are all things that are included in the president's budget, much to be debated, but great impact potentially on oral health. So it's not a time at all to relax our advocacy and education efforts, but a time to really step them up. And just in closing, I'd say, just as a reminder to folks, that 60%, if we look at a national level, and Pennsylvania falls pretty well in line with these numbers, but 60% of all long-term care and nursing home care is paid for by Medicaid currently. 60% of care for kids with disabilities comes from the Medicaid program, and half of all pregnancies and deliveries annually across the country are covered by Medicaid. And as I said, Pennsylvania's numbers line up pretty closely with those. So this is not something that's relegated to one small segment of our society. We're talking about big impact for older folks, younger folks with disabilities, and everybody in between. And so really an issue for us to continue to pay attention to. And from a PCOH perspective, we're sorting through a lot all the time, and we'll continue to pass along those things that are most relevant. And I'd encourage anyone, if you have things that you come across through your individual sources that you believe may be relevant to our advocacy efforts, please feel free to forward them to Helen or myself, and we'd be glad to get them out and make sure they're incorporated to our messages as we move ahead. Helen, did I miss anything?
Well, I think that's probably the best, 3-minute recap you could possibly give. So it's a lot of information, and I'm glad to have Jenny talk about it. So our next priority then is the advancing the implementation of the 2020 PA Oral Health Plan. And so some of you who joined us at our in-person meeting back in Plymouth meeting in March, we had a presentation from Jan Miller, our partner at the Department of Health, and she told us a little bit about this plan. We are really, excited to have this happening. It's kind of been a long time coming to have a really robust oral health plan that we can use with really great measurable objectives. So it's been kind of worked on over the last year by a core team. There's 3 main focus areas to the oral health plan. We've got access to oral health care and prevention, oral health workforce development, and oral health infrastructure. So, and then underneath each of those 3 focus areas, between the 3, there's about 36 individual objectives, which I will not read those to you. But we do have that information available. We did send out the draft of the plan through our email list. So if anyone missed that or needs to see it, please let me know. It's also, there's a link on our Facebook page to it as well. So, we distributed the draft form last month. We did get some comments from, some of our members and collaborators that we work with. The team's working on addressing all of those concerns. And then our hope is that it can kind of go up the line within the Department of Health in next month. I almost said in July, like that was months away, but that's just next month. And that we could maybe get a final version of it coming out right after that. Now, with that comes some work on the part of PCOH. We're going to be assisting with the implementation. So, looking at the plan, working with the Department of Health to come up with some kind of dedicated timelines for each objective that's within the plan. What needs done first, second, and third. We'll also be holding regular meetings in collaboration with our quarterly meetings of PCOH. We're happy to have Jan Miller from the Department of Health work with us on that, and kind of make sure that everyone around the state has some input into not only the plan itself, but also how it's being implemented and the things that are, made the first priorities. We'll be also distributing progress reports and newsletters on the implementation of the plan. So, you can stay tuned to kind of hear the nitty gritty of how it's all going to work and what's going to be next. And what I would like to say there too is that, this plan, the 2017 to 2020 plan, is really a launch pad for even a more thorough plan that's going to come out in 2020. So I will say that, we had, some concerns that, maybe we weren't completely all encompassing with this plan, but it's pretty tough to fix every problem in 3 years. So I would ask for patience with that as we work through it and make sure that everyone's aware that we know there are even more issues that might not even be referenced in this first plan. But we're hoping that we can use this time to really come up with an even better plan for 2020. And then I also did want to mention at this time about the department unification process. I'm sure that most of you have already heard about this, but our Department of Health, Department of Human Services, Department on Aging, Jenny, help me.
And Aging and Drug and Alcohol.
And Drug and Alcohol are all unifying into one department, much like at the federal level, I believe, which is the DHHS.
Right.
So that has, been announced that it's going to be happening. And it sounds like they're moving fairly quickly on it. Would you agree with that, Jenny?
Yes, I mean, I in the work that we do, the interface we do with several of those departments, we're seeing already plans put in place. So there's certainly some elements that I understand are tied to budget, but much of the reorganization is planned out pretty thoroughly and moving ahead. So I'd encourage you to take a look at, there's a whole website devoted to it, and lots of org charts. And so if there's particular offices or positions you're interested in where they might go, and this isn't an overnight process, so I can't remember exactly the timeline, but over a couple of years looking at making all of those changes to really unify all 4 of those departments and then redesign all of the workflow associated.
Yeah, and hopefully that will, you know, manage our resources more wisely and lead to better outcomes and more connections for all the folks that use these programs.
Right.
So, and then getting back to the oral health plan, I did want to just say, if, you know, if there's a part of the plan that you really feel passionate about, you know, we're going to start as everything kind of gets published and launched. We will be maintaining a database of all of our implementers. So if you want to, you know, be sure that you're involved, obviously we'll be doing it through our coalition work. But if there's something that you feel really strongly you need to be, you know, directly involved with within the plan, please let us know so that we can make sure we're including everyone who wants to be included. So our last but not least, when we're talking about our 4 priorities, advocating for community water fluoridation. Okay, so when we're talking about that, you know, we have a problem in our state that we're only 41st in the rankings for percentages of our residents who get community water fluoride in the community water systems. We've had some prior attempts at statewide legislation. They haven't been successful. It's kind of the hottest topic when it comes up. And so that's something that, you know, we have to kind of keep an eye on. We want to promote that. We'd like to see us kind of go up and rise in the rankings. And Jenny, can I ask you to look at the Q&A, and you might be able to address
Yep.
this while I'm going through the slide?
Absolutely.
Thank you. And so, you know, we've trained in November of 2015, about a year before our summit. We did train a community water fluoridation team. We had Matt Jacobs come in from the Children's Dental Health Project. And, you know, the purpose of the team was to reach areas of concern, to kind of blanket the state with folks that could be, you know, knowledgeable resources for any parties that needed help. You know, we can provide testimony at meetings, and then anybody who's interested in learning more about fluoridation then can do that. So that being said, we do need some help with our team. We have need for at least 2 more team members, one in the northeast area of the state, and then one in the Lancaster, Lebanon, York area, Chambersburg area, somewhere in that kind of south central area. We have 10 different regions underneath the municipal authorities, and so it's nice to have at least 10 members of the team who can go out and really get one-on-one contact within those authorities. So our you know, water authority workers are really, we need to engage with them to kind of get to be a resource for them as well. And then something else that we'd like to do in addition to our fluoride team, which I have to say, you know, Dr. Alicia Risner-Bowman has been really instrumental in developing a toolkit that we can use. So if you need information on letters for support, letters to the editor, if you need the scientific facts behind water fluoridation, we have that all assembled in a really nice toolkit, and we can give you pieces of that as needed for sure. So that information is available, so please, you know, let us know if we can help you with that. And then one of the other things that we'd like to see happen is to offer some more professional training for health professionals and any other interested parties on community water fluoridation. You know, even, you know, with a background of working as a clinician, I know that I didn't always have the exact scientific knowledge to answer every single question that a patient gave me. And so what I have found is that, it'd be great to get some of these health professionals trained so that if your patients and these residents of the water authorities are coming to you with questions, that you're able to answer them, and have that backup for yourself. So we'd like to offer some trainings kind of to follow immediately after our local quarterly meetings that we host. So we'll talk a little bit more about that when we go through our meeting dates. But that is something that we'd like to do, and we're hoping to do about a 90-minute presentation and to offer continuing education credits for that training as well. So just as an FYI, we've got 2 current areas of concern, and if you're from these areas, I'm sure you know this. Meadville has been kind of an area of concern for about the last 3 years. They've been debating whether or not to add fluoride to their water, and they will be voting on June 14th. And we've spoken at some of the public meetings and we've provided testimony. I do have their email listed here on the slide, which again, we'll distribute the slides after for those of you who are on the phone. If you'd like to send a letter of support, just letting them know why you support community water fluoridation, that would be great. And then the second area of concern that I have listed is Johnstown. Johnstown is currently fluoridated, and they are debating, mostly for cost reasons, they are debating removing the fluoride from the water there. Now, they actually will be talking about this on June 6th, so it's a very quick turnaround to send in any letters of support. But in particular, if you know of people in that area, or you're from that area, it's really going to be helpful for the residents there to speak up. So even if you have a family member who lives within that district, have them speak up and send a letter supporting keeping the fluoride in the water there. So now, let's see here. And then I'm just going to have Penny talk a little bit about Pennsylvania's involvement in the DentaQuest Foundation's 6-state strategy.
Sure. We wanted to make sure that everyone was aware, because I don't know that all of us were till most recently, but DentaQuest, as many of you know, has been funding a variety of efforts across the state of Pennsylvania, and we'll review those specifically following this slide. But we wanted to highlight today that there are 6 states that you see on your screen, Pennsylvania top of the list, that DentaQuest has identified for particular focus, both in the past couple of years and now really called out specifically. The last couple of years has really built funding and infrastructure in these states, and now they're really defining a clear six-state strategy, of which Pennsylvania is included, so that one allows for additional resources to come to our state, maintenance of resources that are coming through DentaQuest, and as importantly, technical assistance support, connecting to both what they would refer to in their efforts as grass top, grass middle, and grassroots organizations. So bringing national resources to bear within our state as appropriate to help us advance policy and advocacy issues. So more to come in this area, but just wanted to make sure that all of you were aware that Pennsylvania is and our oral health work is an area of focus for the DentaQuest Foundation, and I think it will open many doors for us moving forward, and so we'll keep everyone posted on our work in this area with this partner.
Yes, thank you, Jenny. And I think it's just amazing to me that Pennsylvania really is highlighted nationally. And part of that reason is with our silly little acronym POCI, the Pennsylvania Oral Health Collective Impact Initiative. What we have found is that, though a lot of different groups work together for common priorities in other states, what we have in our state right now and that we have started in 2014 was a joint partnership between our coalition, the Pennsylvania Head Start Association, the Pennsylvania Association of Community Health Centers, and the Pennsylvania chapter of the American Academy of Pediatrics. So really four groups that have a lot of reach across the state coming together and working in a true collaborative fashion on common goals. So, we've been doing that, like I said, for the last 3 years. And it's been pretty fantastic. One of the things that, you know, we are planning to do is that by 2020, with our work with DentaQuest, that we would be unified almost into more of a solo single group rather than, you know, just an initiative. And PCOH is going to serve as the backbone for those groups. So you're going to see even more collaboration coming out of that. You know, and I think that for many of you on the call, you've probably been involved in some of these POCI initiatives. But I do have some of them highlighted here, the work that's kind of been done. The community health centers, of course, have held a yearly dental director boot camp. So for federally qualified health centers in our state, they can send their dental directors or other interested parties to learn more about how to manage their dental departments the most effectively. And then they also provide year-round support for the federally qualified health centers to manage their dental programs, and then also to add dental programs for the ones that need to add dental programs. Our Pennsylvania Head Start Association has done some amazing programmatic work. We've got continuing education programs on age 1 dentistry, a really wonderful education tool called Cavity Free Kids. Recently, we've developed some training for community health workers so that they're actually getting oral health information built right into the curriculum as they're going through their programs. And then Dr. Alicia, that I mentioned earlier, is now working on a special needs program that's going to be offered statewide over the next year. And then, of course, going along with that, the Head Start Association also offers direct support for Head Start programs. So they have Amy Requa, their state oral health coordinator, who also serves on the PCOH board, who can give direct one-on-one assistance to Head Start programs that need help with their oral health or getting their kids to dental homes. And then the Healthy Teeth, Healthy Children program, which is the American Academy of Pediatrics program. They've got some really amazing things going on as well. They've started distributing the oral health story kits to various libraries across the state. And the goal is actually to have every library in the state to have one of these oral health story kits in the next year or so. And it gives, you know, these folks that are working directly with impacted communities the ability to integrate oral health into what they're doing for community programs. And then they also offer continuing education programs to medical professionals. They have 2 oral health in your office programs, one that's geared for pediatricians and family practice doctors, and then another that's geared for prenatal offices. So again, just highlighting the importance of oral health with all of these populations. And then, you know, PCOH has really kind of served as more of the advocacy piece of this group. So what we do is we focus on, you know, the communications between the policy briefs and just trying to kind of get the information out there and get all of the interested people connected. And, you know, my predecessor, Lisa Schildhorn, was a great connector. And, you know, what she has done is really kind of helped create this network between everybody that I'm trying to keep up with. So,
you're doing a good job of it, Helen.
Sometimes.
Keeping us all connected.
And all of that just strengthens us, you know, as a state, as a network, all of the above. So along with that, you know, our meeting schedule coming up that we have posted here, because I want to make sure we allow some time for some questions. We've got our upcoming meetings. We've got 3 more in-person meetings for the year. July 14th is our meeting in Danville. August 25th is our meeting in Pittsburgh. And then October 13th will be our meeting in Mechanicsburg. Now, as I mentioned before, we're planning to offer a seminar on community water fluoridation at the conclusion of all 3 of those meetings. We'll also be doing some oral health plan work at the Mechanicsburg meeting as well. So please be sure, you know, we always keep our website updated with this information. You can always reach us through there. And then we're also, you know, trying to keep up with through our social media networks as well. Our next virtual meeting, like today, will be on December 8th. So just in time before all the holidays hit, we can update you guys on oral health, which is a lot of fun. I will also mention that for those of you who may have gotten the Pittsburgh date a while back, we did move that date. So it was previously in July. It is now August 25th. So just wanted to make a special note of that for anyone who might have marked their calendars earlier. And what I will say with that, along with mentioning the social media side of things, is that we do have a Facebook page. If you don't like us on Facebook, you should. We've started a YouTube channel. So for those who were either able to join us at the summit or missed the summit and want to hear more, we have videos of our speakers from the summit up on the YouTube channel. So if you search for PA Coalition for Oral Health, you'll find our YouTube channel. And we have a Twitter account as well. So please be sure to follow us on there. We do have a PCOH listserv, which is still kind of taking off on its own. We will be inviting everyone that's on our regular email list to that listserv, and we hope that you'll join us there. It's a nice way to get all of the information and to actually get one-on-one conversation going between the state and, in between everyone in the state. And as I told Dr. Dishler, I would definitely talk about Mission of Mercy. For those of you who aren't familiar with Mission of Mercy, it's a national initiative that, we've been hosting in Pennsylvania. This is our 5th year. And by we, I mean the state hosting. The PDA is actually really instrumental in developing this and promoting it, and they're really the main sponsor for it. But it is such a collaboration of so many different groups. It's a wonderful thing to do. So that's coming up in just 2 weeks. We have our mission in Erie. It's a 2-day event, and they still need volunteers. Volunteering registration is still open. So, and that's for lay people, health professionals. They need translators. They need pretty much everyone to volunteer. So even if you're already going, maybe you can convince a friend or family member to come along with you and serve as a lay volunteer. That would be fabulous. So their website is, mom-n-pa.com. And then we also have our friends at UPMC are going to host another Mission of Mercy event this year in Pittsburgh, which will take place over July 28th, 29th. And so that website is mompittsburgh.org. So that's there. And then I am going to do a quick other poll here to see how everyone if you're able to participate here, to see how everybody really likes getting their information from the PCOH. So I've got the poll up now just to see, your preferred method of contact for all the news that we distribute. So take a second, and you can actually check multiple boxes on this one. So feel free to pick a couple of your favorites. And then what we will do.
Helen, to date, how is I know that our uptake on the listserv has been a little bit slow. So how, can you give me a number, or that might be encouragement to people to jump on?
Yes. Yeah. And I think right now we're at around 50 members, which, for those who are familiar with listservs, the fewer people you have on it, the less conversation that happens, and it's not as engaging. So one of the things that we will be doing is sending out, we can do a mass invite from our email list. So for those of you who get our emails, you will also be getting an invite to join the listserv. So I encourage everyone to take advantage of that. And that'll be coming out in the next week. So that would be, it would be great if we can get more folks using the listserv. And it's very easy. You just email your questions to a main address, and it sends it out to everyone.
And I just saw we had a couple of people, as your screen is shared, join like us on Facebook during the call. So that's a good thing. Thank you to those folks.
Absolutely. And that's, it's become such a tool, and it's really easy. It's a great way to get information quickly.
And inexpensively.
Yes. And I think sometimes too, waiting for, quarterly newsletters is great. It gives a nice, quick summation, but if you want just little pieces of information all the time, we are staying very active with our Facebook page. So hopefully that will keep everybody up. I'm going to go ahead and end polling on here. It looks like we've got over 30 responses. And definitely our email blasts everyone loves, so that's wonderful. And virtual actually won out twice as much over in-person meetings.
This is why you ask people, right? You
Yeah,
learn
exactly. You guys don't want to see me talk with my hands, I guess. So, all right. So thank you very much for giving us that information. That's super helpful. And let me see here. Okay, and I will, we have our question from Teresa Hopkins of asking about the Mission of Mercy in Erie and the Mission of Mercy in Pittsburgh. They actually are chaired by different groups, so they're not related, though they're still Mission of Mercies because they're using all the same equipment and the support, you know, from that group. And then, you know, I don't know that it's affected a lot because the Pittsburgh mission information really just came out in the last week or so. Erie has been struggling, so I would love to see more people get up to Erie. I think they have a little over 700 volunteers, so they still need a couple hundred would be great. And so what I have been trying to do when I'm talking with people about it, and I hope everyone would do the same, is to, you know, even if you are closer to Pittsburgh, to try to volunteer for both missions. Even if you can only go up on Saturday for Erie or do one shift, it's still helpful. So I would encourage everybody to do that, to just try to get everyone that you can thinking about Erie and getting the folks there so they can see the maximum amount of patients. The Pittsburgh event is a smaller event. They're only going to have about half the amount of chairs. So the need is going to be great for Erie. You know, and the idea of the Pittsburgh mission was to be more local, I believe, you know, to really just keep the momentum going that we started last year. But the state Mission of Mercy will still continue to move around. So I hope that answered the question thoroughly enough. So as we move on here, let me see, I've got one more question popping up. Oh, no problem, just making sure I answered well enough. And so I thank everybody for listening. I do have one last poll, and then if you have any questions right now, feel free to type them in. I'm going to put up the last poll here. This is just for if anyone has kind of any imminent concerns or questions in regards to oral health in our state, and if you're saying, hey, you know what, I really need to talk to somebody about this, you know, if we can't answer your question, we will find someone who can. So, you know, please take advantage of the time here that if you check yes, then I will get back to you, you know, as you specify here. And I just got my notifications, Jenny. I don't know if everyone can see that on my screen, but it just popped up that we do had five new likes on our Facebook page.
That's great. So. That's one indicator of a successful virtual meeting. So it's great when we can see that in real time and get that feedback, and for you all to do that in the course of the meeting. It's really fun to see how we can leverage technology for this statewide organization and connect us all in this way.
Absolutely. And so any other questions on anything that we talked about, our priorities, or anything else that has kind of come to mind? We have so much going on. I feel like we could probably have a 4 or 5 hour meeting and not run out of things to talk about, which I guess is what our in-person meetings are for. Right. But did want to just to put that out there. And again, all the information that we've talked about is, you know, contained within our social media pages with our website. So we do try to keep that updated continuously. So make sure you check back to those locations. And if you can subscribe to our YouTube channel, that's great. We can get a personalized channel once we get so many subscribers. So I've been pushing that big time so we can get everyone on the YouTube channel. The work of our POCI group is also highlighted in a video on the YouTube channel, which is great. Yes, and Melissa Allen is asking about the Pittsburgh Mission of Mercy event for July 28th and 29th. That is actually being held at the AJ Palumbo Center. So, and that mompgh.org website, I believe, has all of the answer on there. Absolutely, Melissa. And any other questions there? Let me see. I'm going to go ahead. We'll end polling here. It seems like almost everybody's doing pretty good. No major concerns or questions. We do have a couple people who would like to be contacted, so we will definitely get a hold of you within the time frame there that you requested. And okay, any other questions as we're wrapping up here? We might actually finish early. There aren't very many questions.
On a Friday afternoon, I don't think anyone will complain. I really want to thank everyone to have, 50 folks on the phone with us on a beautiful Friday afternoon. Just reinforces the interest and the dedication and commitment that this statewide network really has to advancing oral health for everyone we come in contact with. So I want to thank you, Helen, and Holly, who is behind the logo at this point on your screen, who helped Helen and I make sure that all this technology worked and that we could all hear one another and all that good stuff. So this really has been a group effort, and I want to thank everyone for their participation.
Yes, thank you, everyone. And if we don't see you at a live meeting over the next few months, we will hope to see you back virtually in December.
Great. Thanks, everyone. Have a good weekend.
Yeah.